Thank you for having me. As Meg mentioned, I'm a freelance health journalist and the author of Rebel Bodies. Few of the publications I've written for. Over the last decade, my work has covered lots of different areas of women's health, so not just gynecological and maternal health, but also kind of wider physical and mental health as well. And over the last 5 or 6 years in particular, I've become really interested in gender bias, health inequalities, medical misogyny, and the gender health gap, and how these issues affect women across their entire life course and across the entire healthcare spectrum. In 2018, I founded the feminist health blog Hysterical Women, and that eventually evolved into my book, which was published last January, now available in paperback. Rebel Bodies is an exploration of the gender health gap, and in case anyone hasn't heard that phrase before, that refers to the disparities in healthcare treatment and outcomes between men and women. But it's also I was very keen that Rebel Bodies was not a completely depressing book. There's a lot in it that's very bleak. I also wanted it to be a celebration of the amazing and really inspiring movement of patient advocacy and activism that we've seen gaining momentum across the women's health sector in recent years. So as we're here today to talk about young women, I wanted to share a few stories of young women who I've interviewed over the years, and the kind of the themes that have come out of those stories, really. So these are 5 young women I'm going to tell you about, and in some cases they're mothers, who I've interviewed over the last decade. And first up is Robin. So Robin actually was one of the first women who really got me passionate about this subject. She was one of the inspirations behind Hysterical Women. And she's actually about the same age as me, so obviously still an extremely young woman, I'm sure you'll agree. But her story starts 20 years ago with her first period when she was 13. And from her very first period, Robin experienced extremely heavy bleeding, she experienced severe pain, she felt so weak around her periods that she started collapsing in school, and she had to cut back on her normal activities because of the unbearable pain, the weakness, and the fatigue. So to lots of you sitting in this room today, those might sound like really obvious symptoms of endometriosis. And that's what Robin's mum, Jackie, thought, having suffered with endometriosis herself. You can see from the quote that I've included there that was not the experience that Robin and Jackie had when they went to the doctor. So, Robin spoke about being dismissed as hysterical women, being palmed off, believing that she didn't understand what periods were supposed to be like. And they actually said that her mum had projected her own experience onto her daughter. She was being overdramatic, she was attention-seeking, and she was trying to copy her mum. Robin's GP actually refused to refer her to gynecology until she was 18, on the basis that she was a child, and instead referred her to paediatrics, who dismissed her symptoms as growing pains. It wasn't until 10 years later, when Robin was 23, that she finally got a diagnostic laparoscopy, and she was diagnosed with stage 4 endometriosis, which is the most severe and widespread form of the disease. So that 10-year delay in her diagnosis had allowed the endometriosis to progress unchecked. It had spread to around the outside of her uterus, throughout her pelvis, her bowel, it was outside her bladder, and it had spread into her vagina and her rectum. It had done permanent damage to her bladder and bowel, and even after 5 surgeries, Robin was left with long-term bladder, digestive, and pelvic floor issues and constant pain. And Robin's story is shocking. I remember being shocked about it at the time when I first interviewed her 6 years ago now, but it's not even a particularly extreme example. The average diagnosis time for endometriosis in the UK is between 7 and 8 years. And in the 6 years that I've been writing about this stuff, I have heard countless stories similar to or even worse than Robin's. And I often start by talking about endometriosis and other menstrual health issues because they illustrate so many of the broader issues that I talk about in the book. I think there is now much more awareness, fortunately, that problematic periods have been normalised, have been deprioritised, have been under-researched by medical science for a really long time, and that has been leaving women like Robin in chronic pain. But what I still see fewer conversations about is the way that these attitudes seep into other areas of women's health and the implications that that can have. So I wanted next to talk about cancer. And I'm going to tell you the stories of two women, Alicia and Lydia, who were both in their 20s when they developed cancer. So Alicia was diagnosed with cervical cancer, Lydia was diagnosed with womb cancer. And with both of these young women, they were not necessarily the kind of patient that you might expect to have cancer. Alicia was still so young that she hadn't even had her first smear test. Lydia was much younger than the postmenopausal women who are most likely to get womb cancer. In both cases, though, their symptoms included abnormal vaginal bleeding. Things like bleeding when they weren't on their period, extremely heavy bleeding. And these are red flags for gynae cancer. Yet both of these women were initially told that their symptoms were common or normal and not to worry about it. Alicia was told that the bleeding would sort itself out. It didn't. But actually, as a result of her first experience, it was months before she went back to the doctor. Unfortunately, the GP she saw the second time was much more switched on. She was referred for a colposcopy, which resulted in her being diagnosed relatively early still, unfortunately with a very slow-growing cancer. Lydia was initially told that she had a fibroid, which is a benign uterine growth, and it took several trips back to the doctors before they agreed to remove it, at which point they discovered it was cancer. It was only after she became anemic that they agreed to remove what they thought was a fibroid. But I think it's worth pointing out, up until that point, she'd been going to doctors complaining of the fact that she was regularly flooding through her clothes. She was bleeding for more than a week at a time. She had to set alarms during the night to change her period products. And I just feel that even if it had turned out not to be cancer, if it had turned out to be a totally benign growth, why are we okay with women living like that? I think this is at least in part a consequence of that attitude that says, it's normal for women's periods, particularly young women's periods, to be all over the place, and it's not really a medical issue. And then the last two young women whose stories I wanted to share were both stories that were initially submitted to the blog. They both also feature in Rebel Bodies, and I particularly wanted to share these stories because they don't relate to gynae health issues, but to other forms of physiological health, which I think, still, even with all the talk about the gender health gap that we see at the moment, tend to get overlooked a little bit. So Rhiannon, who you have here on the left, was a 20-year-old drama student. She was struck down by excruciating back pain, and she describes being unable to move or breathe normally, screaming uncontrollably while she was in A&E, throwing up, even at times drifting in and out of consciousness. She went to A&E 3 times over 3 days, where she was given an X-ray, she was given either some painkillers or some sedatives, and told that there was nothing wrong with her. She was having a panic attack, and to go away and stop wasting everybody's time. On the third occasion, Rhiannon's mum had travelled to London to be with her, and it was her who put her foot down. And just as an aside, there is a really, one of my favourite chapters in the book, although it's a very harrowing one, completely dedicated to these amazing, badass mothers advocating for their daughters. And in Rhiannon's case, her mother's intervention quite literally saved her life. She had been told, you're having a panic attack. It actually transpired that she was seriously ill with pneumonia, pleurisy, pleural empyema, a flooded chest cavity, and an almost fully collapsed lung. And this combination is incredibly rare, particularly in someone of her age, but potentially deadly, and she had been sent home with diazepam. She was in hospital for 2 weeks before being discharged to continue recovering at home. And the final story is Merrin, whose story is by far the most harrowing in the book. She caught a virus at 15. She developed a post-viral condition called myalgic encephalomyelitis, or ME, which you may know as chronic fatigue syndrome. Merin became very seriously ill. She went from an energetic, vibrant young woman to someone who was severely disabled and who needed to rely on her mother for full-time care. Yet for years, her symptoms were dismissed as mental health issues. She was told she was depressed. She was told she had an eating disorder, despite the fact that, having been referred to child and adolescent mental health services, they agreed with her that her symptoms were physical and not psychological. At one point, her mother was accused of fabricating her illness. A social services referral was made. Unfortunately, the social worker who came out said, "I can see that this is absolutely ludicrous," but that was such a traumatic experience for them. And Merin very sadly died at the age of 21, and her death was ultimately attributed to severe ME. And her mother, Claire, likened that kind of vindication, if you like, to the witch trials. She said, "It feels like they were saying, 'Death means we believe you now.'" And those words just kind of rattled around in my brain for weeks and weeks after I'd interviewed her. And obviously these last two stories in particular are very extreme examples, but I wanted to share them because I think they really powerfully illustrate some of the different ways in which young women can come up against the gender health gap. You know, something that comes up again and again throughout women's lives, as I mentioned earlier, is the normalization of pain and suffering. So when you think about gynae health, when you think about maternal health, obstetric health in particular, there's this recurring idea that periods are supposed to be horrific, that the menopause is supposed to be horrific, that childbirth is meant to be undignified, traumatic, and that things like debilitating postnatal incontinence or prolapse are just the price you pay for having a baby. And I honestly can't tell you how many women have told me that they went to their doctor and they were told, "That's just what periods are like," or "That's just what all women have to go through." You know, that with this kind of shrug that says, "This isn't really a medical problem, you just have to suck it up and get on with it." And very often this starts young. It starts often with first experiences of periods. And it has lifelong consequences, as we've seen with Robin, Alicia, and Lydia's stories. So, a few of the themes. And I should say, you know, these are themes that are present throughout the book. They're present in women of all ages. But I think paternalism and this kind of patronizing attitude is particularly something that you see with young women. You know, there is a different kind of paternalism and patronizing at the other end, as menopause campaigners will tell you, I'm sure. But, you know, we see young women not being trusted to know their own bodies, not being trusted to understand what's normal or abnormal for them, not being trusted with the necessary information to make informed decisions about their care. You know, it is very much this attitude of doctor knows best and this is in your best interest. It's really important to point out as well that this is an intersectional issue. It is hard enough for white, well-educated, comfortably well-off young women with mothers who feel confident enough to advocate on their behalf to get the treatment that they need and deserve. But there are so many additional challenges and biases facing women of colour, disabled women, queer women, trans and non-binary patients, among others. So the next theme that comes up, again, over and over again in the book and in my wider work, is this knowledge gap. And that is a term that was coined by American journalist Maya Dusenbury in her book, Doing Harm, where she talks about the gaps in medical knowledge, in research, in diagnostic tools, and in treatment options when it comes to conditions that disproportionately affect women. So endometriosis obviously is a prime example of that, but so too are conditions like lupus, like migraine, eating disorders, ME and long COVID, fibromyalgia, Alzheimer's, and many more. And endometriosis awareness has definitely moved on since Robin first saw her GP 20 years ago. But I think the fact that diagnosis times remain so stubbornly high really proves how much of a long way we still have to go. But another challenge with endometriosis, and I interviewed a paediatrician about Robin's experience, and he said, it can only be diagnosed still surgically through a laparoscopy. And a lot of doctors don't want to be cutting up 13-year-olds just to have a look. So that is a real challenge. Like so many female-dominant conditions, endometriosis has been under-prioritized, underfunded. It affects 1 in 10 women and people assigned female at birth, but it's not rare. But we don't know what causes it. There's no cure. Young women like Robin are kept waiting until they're adults, even just for a diagnosis. And then finally, we have this reliance on stereotypes, mental shortcuts. Juliet mentioned some of these earlier, things like hysterical, attention-seeking, and anxious. The strong black girl is one that comes up a lot when I speak to black women about their experiences, the neurotic mother, and these are used to dismiss genuine concerns. There are also stereotypes about the type of person who is affected by a particular condition. And heart attacks are a really good example of this. They're still seen as primarily a male problem, despite the fact that coronary heart disease kills twice as many women as breast cancer. But it results in women, particularly younger women, who don't necessarily meet other risk factors, being misdiagnosed in a similar way to how Rianne was, as having a panic attack. And similarly, the way that abnormal period symptoms have been normalised means red flags for gynae cancers are missed, particularly in younger women who don't necessarily meet that kind of typical profile of a cancer patient. One of the doctors I interviewed for Rebel Bodies spoke about how the current NHS crisis, where healthcare professionals are understaffed, under-resourced, and working under completely unsustainable time pressures, forces them to become ever more reliant on those kind of mental shortcuts to make quick judgments. So I think it's important to also acknowledge how political choices about NHS funding and workforce can have a huge impact on whether healthcare professionals actually even have the time and the capacity to provide the kind of thoughtful and empathetic care that they would like to provide. So as the stories I've shared today illustrate, there are serious real-life consequences to all these factors. In the worst-case scenario, as with Merrin, it can literally be a matter of life and death. But even in the other 4 stories where the patients survived, you can see how misdiagnosis and delayed diagnosis have such a huge impact on young lives, whether that is in a physical sense through kind of long-term complications and disabilities, or whether the impact is more psychological, or equally both. So it might affect their careers, it might make them less able to work full-time, as was the case for Robin. It might affect their future relationships, their fertility and family plans. And there's a real sense around trauma and medical PTSD, which I hear a lot about, from women of all ages, whose trust in the healthcare system has been hugely undermined, hugely damaged by their experiences. And that, again, has serious long-term implications, not just for the immediate problem, but actually it means that young women, and particularly young women from more marginalised backgrounds, are less likely to seek help in future, which Rebecca alluded to earlier. So having said all of that, as I mentioned earlier, I didn't want Rebel Bodies to be a totally depressing read because I think there are lots of reasons to feel optimistic too. I spend a lot of my life talking about the bleak, depressing stories like these, but I've also spent a lot of the last decade feeling very inspired by the campaigners, the patients, the healthcare professionals and advocates who are out there trying to make things better. So the subtitle of the book, if you can see, is A Guide to the Gender Health Gap Revolution. Because to me it really feels like we're at the very beginning. We're in the kind of infancy of a movement that is really kind of starting to get this issue on the political agenda. And young women have such an important role to play in that. Conversations like this really were not happening 5-10 years ago when I first started writing about them. So it feels really important to highlight how far we've come as well. So thank you all for listening. Small plug, if you are interested in reading more, there is a discount code that you can use, RBPB20, to get 20% off at Bloomsbury for the paperback. So thank you very much.